There is a lot of confusion among the patients about PRP and GFC. So which is better? PRP is better or GFC is better? What is the difference between two? Whether PRP will work good for you or you have to choose GFC? Let us understand from this video. So what is PRP? The full form of PRP is platelet-rich plasma. And what is GFC? GFC is a growth factor concentrate. Now PRP is platelet-rich plasma. That means the platelets are there which are aggregated in a concentrated form, and they are ultimately going to release growth factors which is going to help in your hair growth. Whereas growth factor concentrate is nothing but a concentrated form of a growth factor solution. So in the end, what we want is the growth factors. All we want is growth factors to go there and act on the hair and give signals to the hair to become better. GFC is nothing but the advanced form of PRP or a modified version of PRP. The concept of PRP as well as GFC is nothing but the same. Now, along with the supplements, the medications, the serums, what your doctor has given to you, they might sometimes suggest you a PRP session or a GFC sessions to take for yourself in order to maintain your results or in order to give you a good result. And what to choose, they are the best person to tell you. Now what we want here? So we want your vellus hairs to get transferred into your terminal hair. That means whatever the hair has become baby hairs, very fine hairs, we want a little volume in the hair. We want them to become terminal and thicker hair. So that is why we are doing the procedure. So how it is different from PRP? In either of the procedures. So there are some similarities and there are some differences in the PRP and the GFC treatment. So whether it's a PRP or it's a GFC, the method of preparation is the same. Blood drawn from you. So there is a blood that we have to draw from you, just like a normal blood test. It could be up to 20 ml, whether it's a PRP or it's a GFC. And they are collected in tubes in which there are certain molecules which will separate the platelets from the remaining cells and give you a solution which your doctor will be injecting in the scalp. Now, with GFC, we are using certain patented tubes in which there are activators, there are separators. So there is a fixed protocol that you need to follow with those tubes in which you will get a standard concentration of platelets. Whereas in PRP, there are intact platelets. So the preparation of PRP differs from clinic to clinic. Somewhere they'll be using a single spin, in other places they might be using a double spin in order to produce a concentrated form of solution with platelets. So the method of preparation of PRP and GFC is something you have to look into. Whereas GFC is standard at any place that you visit, PRP, the result as well as the concentration of platelets will vary from clinic to clinic. Coming to the second difference, what is there between PRP and GFC is, in PRP the platelets are intact and hence it's slightly painful or the burning sensation is little more with PRP, whereas in GFC it's more of a released growth factors from your platelets. So intact platelets are not there, so the procedure is not so painful and it's not so uncomfortable. In the GFC solution, the platelets have been already degranulated or they have already been extracted of their growth factors and hence it is a little comfortable. Looking at the effectiveness of PRP versus GFC for your hair growth, if PRP is done in an ideal situation, it is as effective as GFC. That means both are equally effective. Only the chance is that there is a slight human error with PRP that might change. There is a variable, there is a human error with PRP, and there is a slight difference in the formation of PRP from clinic to clinic. That is the reason GFC is considered a standard procedure. Chances of error with this process is less, and hence the concentration of platelets and the growth factors, even if you go from one clinic to other clinic for GFC, it's almost predictable because the extraction process of platelets here is a different one. Cost of PRP versus GFC. With GFC, there is an additional cost involved because the patented tubes have to be bought and then they have to be used by the clinic in order to give you enough platelet concentration, in order to give you enough growth factor concentrate. and hence the GFC might be slightly expensive than your PRP. Now let us talk about the number of sessions that are required with PRP or GFC. So according to the thinning of your hair, according to the hair loss that you are experiencing, your dermatologist might guide you for the number of sessions. So they are the right person to tell you how many number of sessions of PRP or GFC you might require. Having said that, 3 sessions is what minimum is required, because single session is not going to make much of a difference, and doctors might suggest 6 to 10 sessions also for you depending on your hair loss. There are other variables also that are different from clinic to clinic, like the depth of injection, the color of the concentrate. If you see the color of the concentrate of PRP, it's slightly reddish because there is some amount of RBC, there is some amount of WBC also that is coming along with the platelets and the serum, which is giving a slight color to the PRP. Whereas in GFC, or the tubes, patented tubes that are used for GFC, there are separators as well as extractors molecules, and they will define a certain level of separation that is going to happen. So there is no chance of getting a RBC or WBC with GFC. So the color of GFC always will be a pale yellow color, while with PRP it will be slightly reddish color.